Welcome to The Explainer. Today, we're telling the truly miraculous, highly complex story of a ligament's sudden demise and its ultimate resurrection. Anyone who watches sports has seen it happen, right? An athlete plants their foot, their knee just completely buckles, and in an instant, their entire season is over. But what actually happens after that devastating moment? How does the human body take a spare piece of tendon and somehow magically transform it into a brand new ligament? Okay, let's just get right into this visceral, split-second moment that changes an athlete's life instantly. We hear the term blown-out knee or ACL tear constantly in the sports world, but to really appreciate the recovery, we first have to understand exactly what an ACL tear is and why it's so catastrophic to human movement.
To grasp the devastation here, you have to know that the ACL is basically your knee's internal seatbelt. It's this dense band of connective tissue right smack in the center of your knee joint. And its primary job? Preventing your tibia, that's your shin bone, from sliding way too far forward underneath your femur, your thigh bone. It acts as the ultimate mechanical stabilizer for your entire leg.
So, here's our roadmap for today's explainer. We'll cover ACL and joint stability, when the ligament tears, the science of ligamentization, overcoming muscle inhibition, and finally, safe return to sport.
Let's start with Section 1, ACL and joint stability.
When this internal seatbelt is intact, it manages immense biomechanical forces with total ease. Jumping, running, landing, the ACL keeps the knee tracking perfectly. But when it snaps, when that tear actually occurs, complete mechanical chaos ensues in the joint. The knee loses its anchor, and that results in this terrifying feeling of the joint just giving way or completely collapsing under the athlete's own body weight.
Moving right along to Section 2, when the ligament tears.
Now, you might assume an injury this severe requires a brutal tackle or some massive collision. But surprisingly, these ruptures frequently happen without anyone else touching the athlete at all. Think about sudden stops, awkward landings, or just trying to change direction way too quickly. These movements create a massive deceleration force. The foot stays planted on the turf, the body's momentum keeps going, and the ligament just literally cannot handle the sheer torque.
And this brilliantly illustrates why sports like soccer, basketball, and football are absolute high-risk zones for that sudden loss of joint stability. Any game that requires you to sprint, hit the brakes, and cut sharply to the left or right puts your knee in the exact biomechanical crosshairs for a non-contact deceleration tear.
All right, let's slow things down and transition into Section 3, the science of ligamentization. We're moving from the violent physics of the break to the truly fascinating biology of how we actually fix this.
Because an ACL cannot heal on its own due to the fluid environment inside the knee joint, surgeons have to reconstruct it using a graft, often taking a piece of tendon from the patient's own hamstring or kneecap. But here is the mind-blowing part. A piece of grafted tendon literally transforms itself into a new ligament through a complex, multi-phase biological marvel called ligamentization. Over months and years, your body breaks down that tendon, grows new blood vessels right into it, and completely remodels its cellular structure to mimic a native ACL. Now, look at how the graft's mechanical strength changes over time. You would think that every single day after surgery, the new ligament just gets stronger and stronger, right? Well, actually, no. The mechanical strength completely plunges in those first few months before it gradually starts rising again.
This highly counterintuitive dip explains the frustrating wait patients have to endure. During the early healing phase, the grafted tissue goes through avascular necrosis, meaning cells inside the graft temporarily die off before new ones can repopulate it. The graft is actually at its absolute weakest point weeks or even months after the surgery. You absolutely cannot rush this vulnerable biological remodeling process, no matter how great the athlete feels on the outside.
But there's a really surprising neurological twist to this recovery story, which brings us to Section 4, overcoming muscle inhibition.
Even after the surgeon mechanically fixes the knee and that whole ligamentization process is underway, the patient faces this deeply frustrating paradox. The knee might be structurally sound, but the thigh muscles, specifically the quadriceps, simply won't fire. The athlete literally tells their leg to flex, and nothing happens.
This is not a lack of effort. It's a condition called arthrogenic muscle inhibition, or AMI. Because the knee is swollen and in pain after the trauma of surgery, your brain literally interrupts the signals to your motor neurons. It's basically an evolutionary defense mechanism. The brain unplugs the muscle to protect the injured joint, and that causes severe muscle weakness that can persist for weeks or even months.
So,
To overcome this brain-muscle disconnect, physical therapists have to rely on some highly specialized interventions. They use a wild array of evidence-based therapies just to fight back against the brain's own defense systems.
Physical therapists essentially have to hack the patient's nervous system. They use things like neuromuscular electrical stimulation, literally zapping the muscle with targeted electricity to force it to contract when the brain refuses to. They use cryotherapy, which is localized freezing, to numb the joint and trick the brain into thinking the swelling is gone. They even use blood flow restriction training and virtual reality to bypass the brain's safety switch and get those motor neurons firing again. It's incredible.
And finally, we reach Section 5, Safe Return to Sport, the triumphant yet incredibly mathematically rigorous bounce back to the field.
Being cleared for sports isn't just about the graft holding together anymore. You see, there are actually two types of stability at play here. Mechanical stability is what the surgeon gives you, but functional stability, that is what the athlete has to earn. It's the dynamic, muscular control required to run, jump, and pivot without the knee buckling or giving way.
And the reality of achieving functional stability is incredibly tough. 55.8%. That is the sobering percentage of NFL athletes who actually return to play post-injury. Think about that for a second. Even with the absolute best surgeons and rehab facilities on the planet, nearly half of professional football players with an ACL tear never make it back. It just proves how incredibly difficult full functional recovery really is.
To safely return, athletes can't just run in a straight line and say, "Hey, I feel fine." They must undergo intense biomechanical testing using high-tech force platforms. Evaluators are looking for microscopic asymmetries to ensure the athlete isn't subconsciously favoring one side, because doing that drastically increases the risk of a devastating re-tear.
To be precise, the difference in maximum vertical ground reaction force between the injured leg and the uninjured leg must be less than a strict 10% threshold during a drop landing maneuver. The margins for error here are razor thin.
Hitting these exact mathematical thresholds, like that less than 10% difference in landing forces or a less than 20% difference in a deep squat, is entirely mandatory. Passing these tests prove the athlete hasn't just healed a ligament. They have fully regained the neuromuscular control needed to safely face those same high-speed decelerations and pivoting forces that caused the injury in the first place.
As we wrap up, it really leaves you wondering about the incredible resilience of the human body. We always think of an ACL tear as a purely mechanical break, right? Like a snapped rubber band. But when you realize that your brain actually unplugs your muscles and that you have to biologically grow a new ligament over 2 whole years, it becomes clear that physical healing is deeply, fundamentally tied to rewiring our nervous system. So how much of recovery is really just convincing your own mind that it's safe to trust your body again? Thanks for joining me on this explainer. Keep asking those big questions, and I'll catch you on the next one.